Welcome to our video about Stevens-Johnson syndrome, an uncommon yet severe disorder affecting the skin and mucous membranes. The skin is divided into the epidermis, the dermis, the subcutaneous, and the muscle layers.
Mucous membrane line many tracts and structures of the body, including the mouth, the nose, stomach, lungs, trachea, and eyelids.
HOS exhibits varying levels of severity, from Stevens-Johnson syndrome involving less than 10% of the body's epidermis to a more severe toxic epidermal necrolysis, where over 30% of the body's surface epidermis is detached. An intermediate overlap occurs when the detachment ranges between 10% and 30%.
The primary cause of Stevens-Johnson syndrome is often adverse reaction to medication, with antibiotics and anti-seizure drugs being common culprits. Additionally, infections such as cold sores and rarely vaccination can trigger this immune response.
HOS instigates an immune response where cytotoxic and natural killer cells release granulysin, a substance that induces destruction of skin and mucosal cells. This inflammatory response disrupts normal cellular process involved in skin cell growth.
Symptoms manifest after 2 to 3 weeks of initiating causative medication. The spectrum include maculopapular rash, bullae formation, mucosal ulceration, and in severe cases, the distinct target-oid rash, often accompanied by fever, headache, myalgia.
Complications of HOS are diverse and can be severe. These encompass sepsis, organ failure, ocular complications, respiratory distress, and in the long term, cutaneous and renal issues. Unfortunately, the most severe complication can be fatal.
HOS is more prevalent in children and adults under 30, with a higher incidence in females. In children, infections are a common cause, while adults, medication reaction dominate. Risk factors include weakened immune systems, family history, and certain genetic markers. Preventing Stevens-Johnson syndrome is challenging given its often unpredictable nature. Those with a history of HOS are advised to avoid specific triggering drugs. Genetic testing, especially for specific human leukocyte antigen, is recommended for certain populations before taking medication associated with higher risk.
Diagnosing HOS involves a comprehensive review of medical history, physical exams, skin biopsies, and various tests to rule out infections. Treatment mandates immediate cessation of causative medications, supportive care, and medical interventions like corticosteroids and immunoglobulins.
In conclusion, Stevens-Johnson syndrome poses a significant medical challenge. The complexity observed highlights the importance of awareness and timely intervention in HOS.
As we conclude this video, let this knowledge contribute to a world better equipped to comprehend and address the implications of this rare disorder. Thank you for your time.